IBS-80 tests are a completely different type of allergy than the traditional skin prick tests and the blood tests that measure antibody levels. These older tests have never been proven to be helpful for IBS, and for that reason the general consensus in the medical community is that food allergies don't play a role in IBS, and most doctors will not order food allergy testing for their patients with IBS. Based on the success of IBS-80, it now looks like these older tests were barking up the wrong tree, looking for the wrong type of allergy. IBS-80 uses skin patch testing, just like we often use in dermatology when we suspect the rash is being caused by something touching the patient's skin. For IBS, a series of skin patch tests to 80 common foods and food additives are applied to the patient's back and left in place for 2 days. The patches are then removed and the skin is examined for allergic reactions. A day or two later, the skin is checked again for additional reactions. If any allergic reactions are found, the patient is instructed to avoid those specific foods that cause the reactions, and often their IBS symptoms improve or completely go away. The lining of the intestine is very similar to the skin. Our research suggests that an allergic reaction similar to that happening on the skin from the food patch test is likely happening in the lining of the intestine when the same food is eaten, causing the IBS symptoms. In the clinical studies that we've published, for the patients that we have follow-up of more than 3 months, over 60% of those patients tested experienced moderate improvement to complete clearing of their IBS symptoms by avoiding the specific foods identified by the patch testing.